Hi, good afternoon, everyone. So, first of all, thank you for staying with us. Can you hear me? Yeah. Thank you for staying with us so long. This is very exciting. We have 2 breaking news. And then we're going to have a session to really talk about the future of care. And then we'll wrap things up with final thoughts. And then dinner is back there where you have had dinner in the last few nights. It starts at 6:30. Remember, there's a film, a theater on at the poolside at, I think it's 7:45. So 6:30 dinner, then 7:30-ish, 15:30, something around there at the pool. Just go to the pool after that. You'll be tired. You'll need something refreshing, and then go to the pool for the film. So breaking news is always kind of amazing, right? And I have to say that we at PPMD, as we planned the conference, had a little insight into what the breaking news would be, and it was incredibly exciting for us. But I just want to begin with the story before I introduce Paolo from Italfarmaco, and then Linda Marban. In the story of the Italians, the Italian parent project, Filippo Bacella, and a basic scientist who has a laboratory both in California and in Italy, Lorenzo Puri, we're looking at HDAC inhibitors, which is a chemistry that I probably can't explain, so I'm not going to try. So I think that would be best. So they had this precious HDAC inhibitor, and they went knocking on the door of Italfarmaco, and Italfarmaco opened the door and said, yes, we'll try. So I'm here to say that they have breaking news today. It's been 4 years, and it's pretty amazing, and I'm so glad you're here, and congratulations, and I'm not going to, it's a little bit of a cliffhanger, so Paolo, up to you now.
Thanks, Pat. Thanks for the introduction and the kind words. And it's really a pleasure to be here, well, in person, first thing, and then also to share with you the result of our EPIDYS study. As usual, my disclaimer, so I'm a full-time employee of Italfarmaco, the manufacturer of GIVINOSTAT. GIVINOSTAT is still currently in development, so is not available and approved for sale in any country, including the USA. And my presentation is obviously for scientific purposes. So before I actually, and also to create a bit of suspense, let me spend a few seconds really to go through how we describe the mechanism of action of GIVINOSTAT. So by now you have heard a zillion times that dystrophin is playing an important mechanical role in the muscle fibers. Well, one thing that we need to remember is that dystrophin is also playing an important role in controlling the production of factors that actually regulate the regeneration of muscle fibers. And actually, dystrophin does that by controlling the HDAC. And so when dystrophin is missing, as is the situation in the Duchenne muscle, on one hand, you have the mechanical instability, so you have more damage of the fiber. This triggers inflammation. And on the other hand, you also have the overactivity of the HDAC. And this actually translates into less regenerating factors being produced. So as a result of that, not only you have more damage of the muscle fibers, but also the repairing system doesn't work properly. So instead of replacing the muscle fibers which are damaged with new muscle, this is actually being replaced by fat and by scars. So when we add GIVINOSTAT to the equation, what we have is actually on one hand, within the nucleus, GIVINOSTAT is actually modulating the HDAC, so more, if you want, factors that regulate the regeneration of muscle are being produced. And on the other hand, in the matrix, GIVINOSTAT is actually reducing inflammation and reducing fibrosis and fatty replacement. So if we put all this into a cartoon, on the top panel, you see the situation in Duchenne, with the result that you can see on the right-hand side, which is an example of a muscle biopsy. And when you add GIVINOSTAT, you actually reduce tissue damage, You reduce myofibril necrosis, inflammation, and adipocyte and fibrotic replacement, and you actually restore, improve the muscle fiber regeneration. What I have summarized is actually the result of the work that was done by Puri and then later on also by us in the MDX model. But I think even most importantly, it was replicated in our phase 2 study in Duchenne boys that were actually treated for 1 year with GIVINOSTAT on top of steroids. And as you can see at the bottom, all these data have actually been published. So obviously that led to our EPIDYS study, which is summarized in this slide. This was a randomized, double-blind, placebo-controlled study. It was conducted with enrolling 179 male ambulant boys in US, Canada, and Europe. The randomized boys were randomized 2-to-1 to GIVINOSTAT and placebo, so 2/3 took GIVINOSTAT and 1/3 took placebo. The objective of the study, as you see written there, it was to understand whether GIVINOSTAT could preserve the muscle mass and delay the progression of the disease. The boys enrolled in the study were followed up for 18 months, and during these 18 months, at least every 3 months, they were actually visiting the clinical site for assessment, both in terms of safety and in terms of function. And every, at 0, 12, and 18 months, also an MRI was done. And as you can see in the cartoon, at the end of the study, all boys were allowed to actually transition to the open label study, which is still ongoing, and I think it's important to say that I think only a handful did not accept to move into the open label study. Okay, the kids enrolled in the study had to meet these selection criteria, so they had to be 6 years and older. They needed to be ambulant. We actually allowed any type of genetic mutation given the mechanism of action of the drug, and they had to be on stable steroids for at least 6 months. We also decided to actually have the efficacy assessment on what we are calling from now on the target population that was defined as a group of patients that based on the inclusion criteria, both in terms of function and in terms of MRI, were expected to not lose ambulation in the 18 months and also to have some decline within the 18 months, allowing the ability to actually show an effect of the drug. The endpoints that were measured are listed here, the primary and secondary endpoints. So the assessment was done by comparing the change after 18 months in this parameter compared to baseline and comparing the two groups, GIVINOSTAT versus placebo. The primary endpoint was the 4-stair climb. Then we had a number of secondary endpoints that actually looked at function, like North Star, time to rise from floor, and 6-minute walk test. And we also looked at strength, both in terms of knee extension and elbow flexion. And last but not least, we actually looked at the change in terms of fatty replacement using MRI. Now the result. So firstly, let me describe the group, so what we call the disposition, so how the group were assigned. A couple of information here which I think are important. Firstly, we screened 359 boys to enroll the 179. We know that it has been painful, but I think that at the end, this was actually a good thing to do given the result that you see in a second. The other thing is that 95% of the boys actually completed the study, which is really an excellent job by all the people involved, the clinical side, but also the family and the boys in the study. Another important thing in all this study, you want to make sure that actually the groups that you are comparing, GIVINOSTAT and placebo in this case, are actually well matched, meaning that the result that you obtain at baseline are very similar. And this is exactly the case that you see here. So whether we look at the overall 179 patient or at the in-target population, which was 120 patient, you see that actually the results are very similar. The kids enrolled in the study were approximately 9.5 years at baseline. And another important thing is the equal distribution of the underlying steroids. And as you can see, we had the majority of boys, 75 to 80% on the Flazacort. And another important thing, approximately in the same range, they were on daily treatment. Here you see the baseline value for all the parameters which I mentioned before. Really quickly, just to say that also here they were perfectly matched, and that at baseline, the time to climb 4 stairs of these 120 boys was 3.4 seconds. And here are the results. So as you can see on the left-hand side, this was a baseline value. So the GIVINOSTAT and placebo were very similar with a time to climb 4 stairs of 3.5 seconds. And after 18 months, if we look at the GIVINOSTAT group, that increased to 4.5 seconds. And if we look at the placebo group, that increased to 6.5 seconds. And as you can see, the difference is of 1.78 seconds, and it is statistically significant. So at the end, what is most important, the primary endpoint of the study was met. Then, as I said, we have actually looked at many other parameters as key secondary endpoints, and they are actually summarized, the results are summarized in this plot, which is called forest plot. And let me spend 1 second to explain this plot. So if you see that the rectangle, the blue rectangle actually are all on the right-hand side, that means that all the results are actually favoring GIVINOSTAT. And also you can see that for some of the parameters like the North Star or the vastus lateralis fat fraction, the nominal p-value is less than 0.05. So we look a bit deeper into these results. This is a North Star. There are actually 2 ways to look at North Star. One is to look at the total North Star score. So you are adding the score of the 17 items. But also another way to look at that is to look at how many of the items are being lost in the 18 months. So on the left-hand side, you see the result of the total score. And you can see that in the GIVINOSTAT group, there was a reduction of approximately 2.5 points after 18 months. And in the placebo group, there was a reduction of 4.5 points, with a difference of 1.9 and a p-value of 0.02. As I said, the other way to look at that is to look at how many items were actually lost on average in the 18 months. And as you can see, as far as GIVINOSTAT is concerned, 4 items were lost, and that was actually 7.4 in the placebo group. And also here, the difference was 2.1 with a p of 0.02. Then let's move to the magnetic resonance. As you probably recall, we actually insisted in having the magnetic resonance because we believed that it was very important to have an objective assessment of the effect of GIVINOSTAT, and here are the results. So at baseline, you can see it on the left-hand side, the mean fat fraction in this group was of 15%. Then if we look at the result after 18 months, in placebo, there was an increase of approximately 11% in the fat fraction, and that was approximately 7% in the GIVINOSTAT group. And also here, the difference had a p of 0.03. And on the right-hand side, you simply see some example at the top of the placebo group where you see the white becoming more frequent and covering more space of the image, while in the 2 at the bottom, in the 2 GIVINOSTAT images, that was not the case. There is also another way to look at the data using magnetic resonance, which is the DIXON MRI. Here, as you can see on the cartoon on the top right, you are in essence defining what is called the region of interest. And so you can actually, with this technique, look at more muscle. And obviously, we have looked at the muscle which are key for ambulation. And as you can see in the table, in all of them, we have seen exactly the same result that you have seen before, namely a reduction of the fat infiltration for all these muscles that, as I said, are key for ambulation. Obviously, in all this study, we are also looking at the safety and tolerability of the compound. I'm happy to say that actually what we have observed is perfectly in line with what we were expecting. So the GIVINOSTAT actually had adverse event as any drug, but in 95% of the cases, they were mild to moderate in severity. And only for 3 boys, actually, the adverse event led to withdrawal from the study. If you look at the type of adverse event, also here, they are absolutely in line with what we already knew of the drug. So the very common drug-related adverse events are diarrhea, reduction in platelets, abdominal pain, and increase in triglyceride. And as I said, this is something that we have been observing with GIVINOSTAT also previously. And I think what is most important is that by regulating the dose and by monitoring this parameter, actually then we were able to maintain all kids in the study for 18 months, and they are now still continuing on the open label study. So let me go to the conclusion. Obviously, the EPIDYS study met the primary endpoint and with consistent secondary and exploratory endpoint. GIVINOSTAT showed a good tolerability profile also in this study. And as I said, the drug-related adverse event can be managed with appropriate monitoring and dose adjustment. And let me summarize, if you want, a journey of few years of GIVINOSTAT. As I mentioned at the beginning, we started with, by the demonstration of the activity of the drug in the muscle biopsies at the end of our phase 2 study. This is what you see in the right-hand side, where there was an increase in the muscle area, in the muscle biopsies, and a reduction of the fibrosis. Today, we can add to that also the MRI result, showing also here a reduction of fatty replacement, and the fact that this actually translates into a clinical benefit in terms of function. So let me end up by thanking, obviously, all the kids and their family for the hard work and the dedication to our study, all the organizations that have helped us throughout the way. And last but not least, let me really thank the project team that actually worked on the study under the leadership of Sara Kazzaniga. You have done a great job.
That is incredible news. And maybe next year at this time, we'll see an approval, right? So, well, okay.
Fingers crossed.
Time for 1 or 2 questions? Do we have one?
This is like really exciting and great news. I was just wondering, like since in your study you had boys on different type of steroid regimens, so when you did the analysis, was there some sort of like sub-analysis that you did to see whether a particular regimen was more like suitable to work with GIVINOSTAT, or?
So actually, this is future work. We have not done it yet. But let me stress one point, however, that the 80%, 75 to 80% of the kids in the study were in essence at the best possible treatment because they were receiving daily treatment, and most of them, they were on the Flazacort. So I think this is, to me, is even more impressive what we see with GIVINOSTAT on top of this treatment.
I think this is exactly how we get to combination therapies, right?
Sorry, can I?
Sure, one more.
So, like as Pat mentioned, like hopefully soon we'll progress towards getting the approval. like in terms of label, have you given a thought of like how broad you want that label to be?
So as you understand, obviously, we cannot really speculate on that. The label, the final label will be obviously a discussion and an agreement between the company and the regulatory authorities. So I cannot really speculate on that.
Thank you.
Thank you. Thanks, Paolo. That's amazing. Really good news.